Stephanie. I'll be your nurse today. It looks like
Hello.
we're getting ready to discharge you home. Are you excited?
Yes.
Awesome. Well, it looks like we are sending you home on some new medications. The doctor prescribed lisinopril, which is also known as Zestril, which is its brand name. It is for high blood pressure. That's what we're going to be using it to treat for you.
Okay.
It works on in the lungs to decrease blood pressure.
Yes.
And it also works on aldosterone secretion and increases potassium and decreases sodium in fluid, so you won't retain any fluid in your feet. It should decrease some of the swelling in your feet.
Okay.
It is not a cure for hypertension though, or high blood pressure,
Yes.
so it's important that you continue this medication even if you feel better or you don't have high blood pressure when you start taking it at home.
Okay.
You will take this medication once a day, just one tablet, and it can be either in the morning or in the evening. It looks like he started you on 10 milligrams. This is the normal starting dose for this medication, and we'll just increase it until we get the therapeutic response we're looking for. So until your blood pressure is well controlled, we'll go ahead and keep increasing that dose as long as you're tolerating it with little side effects. The max dose for this medication is 40 milligrams for blood pressure, just so that you know.
Okay.
The tablets will need to be protected from moisture, so keep them out of the bathroom
Okay.
because humidity can be high with showers. And you'll also want to protect it from direct light and heat, so you
Okay.
also don't want them in those areas.
Okay.
If you miss a dose, make sure you take it as soon as you remember, but do not double your dose if it is time for your next dose.
Okay.
So just skip that dose if it's too close to your next one, okay?
Uh-huh.
Some common side effects that may happen with this medication is chest pain, low blood pressure, so you'll want to sit or stand slowly to help with lightheadedness or dizziness, and then you could get syncope, which is also like fainting.
Uh-huh.
You could get a headache and then a cough. The cough is the most common side effect with it, and it's also something we can't change. So once you develop the cough, it's not going to go away as the longer you take your medication. So if it's too bothersome, then let your doctor know. They can change the medication for you.
Okay.
There are times when you'll need to call your provider for instances of like allergic reactions. So if you ever get swelling of the lips, face, throat, or tongue,
Uh-huh.
if you get a rash, it could be a serious sign of Stevens-Johnson syndrome. So you'll want to also stop the medication and call your doctor.
Okay.
If you get pregnant, it can cause injury and death to the fetus. So it's really important that you're using 2 forms of birth control.
Okay.
Do not use this while breastfeeding. It does process into breast milk. And if you need to stop the medication for any reasons, it needs to be titrated down depending on the dose you're on. So it's important to tell your provider so that they can tell you the correct way to stop the medication. So they'll lower your dosage slowly instead of just stopping it. If you stop it abruptly, you can get like rebound hypertension, and that's not, we don't want to do that.
Okay.
If you need to take any new medications, whether they're over the counter or new prescriptions, make sure that you talk to your doctor about that as well so that you avoid any serious interactions.
Okay.
You also want to call if you get itching, swelling, hives, chest tightness, or trouble breathing. Those are all signs of an allergic reaction. It can also change how often you go to the restroom in regards to urinating. So if you start urinating less or more, make sure you notify the doctor. If you get any confusion, weakness, or uneven heartbeat,
Yes.
if you start feeling like you're skipping a beat, that's the time to call your provider. It can cause numbness and tingling in the hands, feet, or lips. That's also very important for you to call your doctor. If your urine becomes dark, your stools become pale, you get nausea, vomiting, loss of appetite, or yellowing of the eyes or skin, also time to call the doctor. It can also cause severe stomach ache, fever, chills, sore throat, and body aches. Those are all kind of like on the lesser side of common, but if they do happen, those are more of emergent, and we need to speak with your doctor.
Okay.
And the references are Karch A&M 2019 Lippincott Course Point for Karch's Focus on Nursing Pharmacology 8th Edition, Walter Kluwer's Health, and Meritive Micromedics.